Good afternoon. My name is Cassie Ricks. I am a student at the University of Kentucky in the MLS program, and I am doing a case study today on Serratia marcescens. My patient information, she is a 69-year-old American female. She was admitted to Mount Sinai Hospital in Chicago after a mechanical fall. The patient was being seen at her oncology clinic and tripped over an oxygen tank. The patient was found to be in systematic inflammatory response syndrome due to signs of tachycardia, hypotension, leukocytosis, and she later developed a fever. Some key vitals on her admission was a heart rate of 137, respiratory rate 28, and temperature 98.6. Patient history. The patient had been diagnosed with a metastatic lung cancer being treated with chemotherapy. This was also complicated with metastasis to the brain and bone. She had hypertension, was a chronic smoker, pulmonary embolism, history of polysubstance abuse, which included IV heroin and cocaine. And she had chronic obstructive pulmonary disease, also known as COPD. So with the treatment of the chemotherapy, the patient was obviously immunocompromised. Some test findings. So some testing they ordered in the emergency department included blood cultures, which did come back positive. A urine culture came back negative. Sputum culture was ordered but was not able to be obtained by the patient. Chest x-ray showed rib changes, which was indicative of a broken rib, most likely due to her fall. Head CT was negative, echo negative, and blood work did show signs of hypomagnesium. The patient received IV fluids and potassium on admission to the ER, broad-spectrum antibiotics, which included vancomycin and cefepime, pain relief of acetaminophen and morphine, and blood culture did come back positive for Serratia marcescens. What is Serratia marcescens? Serratia marcescens is a rod-shaped gram-negative bacterium that is found in damp environments. Some strains produce a red pigment, which can cause a pink discoloration on surfaces like sinks and showers. It is a relatively rare bacterial infection and most likely presents as opportunistic. Can cause urinary tract infections, wound infections, and pneumonia. Serratia species are known to have resistance to multiple antibiotics, and on occasion, multiple antibiotics need to be a part of the treatment regimen in order to be effective. In this picture to the right here, you will see the rod-shaped bacteria and the pink color, which is indicative of a gram-negative. Epidemiology and prognosis. The first known outbreak of nosocomial Serratia marcescens infection occurred in 1951. Many outbreaks have been reported since then, mostly in intensive care units or neonatal ICUs. Serratia marcescens accounts for up to 2% of nosocomial infections. The reported mortality rate associated with Serratia marcescens ranges from 0% to 45%. And in 2023, a review of a total of 57 cases, the overall mortality rate of patients infected was 31%. Symptoms. The presentation of Serratia marcescens is similar to that of infections caused by other bacteria. UTI presentation includes pyelonephritis, urosepsis, and prostatitis. Bloodstream infection presentations can include hyperventilation, tachycardia, dyspnea, fever, pain or discomfort, confusion or disorientation. And pneumonia presentation can include productive cough with discolored sputum, chest pain, fever and rigors, malaise, nausea, vomiting, hypotension, new onset delirium, respiratory failure, septic shock, renal failure, and empyema. The microbiology workup. So Serratia marcescens is oxidase negative, indole negative, VP positive, citrate positive, hydrogen sulfide negative, PD negative, motility is positive, lactose negative, glucose positive, maltose positive, mannitol positive, sucrose positive, and nitrate reduction is positive to nitrites. The patient outcome. After the patient received a positive blood culture and the bacteria was identified, infectious disease department of the hospital recommended a regimen of antibiotics. The patient sensitivity did come back as susceptible to all antibiotics. The patient's condition normalized after antibiotics. A repeat blood culture remained negative for 3 days. The patient was discharged home on Q24 times 3 days of antibiotics, and the patient's follow-up condition with their primary care physician was good. Conclusion. Patients with immune suppression are at risk for infection with opportunistic pathogens such as Serratia marcescens. Antibiotic treatment for Serratia often will depend on the infection severity and sensitivities. Although it is rare, Serratia should be considered to have dire consequences whenever a patient with immune compromising factors presents. Patients who are immune compromised should take caution in areas with damp conditions such as sinks, showers, soil, and water surfaces. In this picture to the right here, this shows a sink, and this pink discoloration around the outer rim is the Serratia. And this is my works cited references. I hope you all enjoyed today learning about Serratia marcescens.